Nurses in Ontario are sounding an alarm about access to personal protective equipment. The head of an association representing registered nurses says the provincial and federal governments are not doing enough to procure the necessary equipment. Doris Grinspun says members of her association have actually fallen ill with COVID-19 because they didn't have access to masks. The federal government said today that they have procured more than 157 million surgical masks and 60 million N95 masks. But will that be enough? What more do frontline nurses need in order to stay safe? Doris Grinspun is the CEO at the Registered Nurses Association of Ontario. She joins us from Toronto. Claire Betker is the president at the Canadian Nurses Association, and she joins us from Winnipeg. Hi to both of you. Thanks for making time for us.
Hi, Sashi. Thanks for having us.
Before we begin, I just want to offer on behalf of all our viewers a huge thanks to both of you and all your members for everything that you're doing. We know that you're on the front lines of this, and we truly do appreciate it. Ms. Grinspun, why don't I start with you? Tell me a bit about what you've been hearing from your members about the availability of PPE, personal protective equipment.
I have been hearing from no PPEs, period, in nursing homes, in home care, 4 days left in nursing homes, only after an outbreak, to all the way to only 2 surgical masks a day in hospitals, to all the way to basically continuing to work, even if you tested COVID positive, which is even more significant, and I heard about that this evening.
So Ms. Grinspun is speaking about the situation in Ontario. Ms. Betker, right across the country, you represent nurses in all provinces. What are you hearing from your members about the availability of PPE?
Well, thank you for the question. We're hearing that nurses are concerned. And, nurses all across the country are essential to our healthcare system, wherever they work, whatever setting they're in. And nurses are always willing and ready to care for the public in times of need, like this one. But they want to make informed choices about their own risk exposure, and they want those choices to be based on consistent, clear information, grounded in the best available evidence and in some of the lessons learned by other countries. And knowing that every possible safeguard is put in place to protect them, and that would include adequate and appropriate supplies and equipment.
Ms. Betker, let me just follow up with you quickly on that. How much of it depends on which province you're in, and what role do you see for the federal government here?
Well, I think the federal government is playing and needs to play a very strong role in this. As I said, clear, consistent information across the country, across the provinces and territories. And so the federal government, and we were very happy, the Canadian Nurses Association today, to hear the Prime Minister's announcements and their efforts. And we've been advocating very strongly with all levels of government to take action, rapid action on this issue.
Ms. Grinspun, what about you? What do you see as the role of both Ontario's government and the federal government here, and how comforted are you, I guess, or are your concerns being put to rest when you hear the Prime Minister today announce, for example, $2 billion on medical equipment and PPE?
Thank you, Sashi. So let me tell you this. I worked during SARS. I was the head of the association back then. There is night and day difference on the way that the federal government is working with the provincial governments and how the provincial government and federal government are working with associations. I have been in touch with both the federal government, the Prime Minister's office, and of course with my own Premier, Doug Ford, and the Minister of Health. And some of these announcements are matching what we are asking. So we are thrilled today with the $2 billion. The issue is the timeline, Sashi. When you are short of PPE to be able to work day in and day out and serve patients, that's a concern. Let me put this in perspective. France ordered 1 billion surgical masks already some time ago. Ontario, just to put that in context for one province, needs 9 million masks a week, 9 million per week. What we have now is 12 million, 11 million from the province and 1 million from the feds for the entire time. That will last us a week and a half if we get it. We don't even have it. So while we're thrilled with the announcement of the Prime Minister, and kudos, and yes, it matches some of what we were saying, the fast forward of delivery is critical. And because we are putting our efforts in both imports as well as the new industry that either is retooling or new startups, which is fantastic. It's something that actually we recommended about a month ago. Retool, we have the capacity in Ontario for sure with the emergency situation and the state of emergency. We need now, because it will take them time to retool and start production and bring it to the maximum capacity, both in PPE and ventilators are needed to save lives. Then we need to fast forward the pedal on imports absolutely quickly before something, hopefully never will happen, but if something happens again in China, and you know that Shanghai was closed already, what happens if Wuhan is closed? We need to fast forward import at the same time as we bring the industry to produce and get those PPEs right away to the hands of health organizations. Health organizations are doing their heroic efforts to protect their workers, but they cannot do it if they don't have the tools. In home care, we are hearing they have 4 days left of PPE. And remember, not only home care treats the patient that has COVID positive and is at home, but actually they treat people with cancer that need therapies at home. That's done by nurses. They need to treat wounds that need to heal, etc., etc. Nursing homes is a disaster what's happening across this country. The outbreaks in nursing homes, Sashi, could be so much lessened if we were to give the surgical mask, the same as in the hospitals in Ontario. You come to work, you get 2 surgical masks. Whether you are a nurse, whether you are a doctor, a personal support worker, you get that mask. We will have much less outbreaks than what we are seeing, Sashi.
Ms. Betker, what about you? What are your thoughts on the timeline specifically? And I found those comments interesting, just sort of, even though the announcement is big now, Minister Baines, who we had earlier on the show, did talk about, you know, some things are coming in the next few days, but others will take longer, especially when you're talking about retooling companies or industries.
Well, you know, I have to agree with Doris. I feel that the time right now is absolutely critical. It's an urgent situation, and the size of the situation is really quite staggering. So I would agree with that urgency and getting it. And I've worked in public health most of my career. We probably will see another wave, right? So not to stand down, like this is serious, and but we're in this together. And we need to win.
You sure are. Really quickly, Ms. Grinspan, because I have to take a commercial break. I apologize.
Yeah, to add to that comment, because that was a concern, right? Can we ever produce too much? And I think what my colleague just said is totally correct. First of all, there might be a second wave. And also, remember, the U.S. is so desperate, so we never will have too much that it will be, even ventilators, we never will have too much. And if we do, and we are so lucky, we can sell them to the U.S.
Okay, I'll leave it there. I really want to thank both of you for making time. Doris Grinspan of the Registered Nurses Association of Ontario and Claire Betker of the Canadian Nurses Association. Like I said off the top, we're so grateful for all that you and your members are doing for all Canadians.
Thank you, Sashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.